Hello, I'm Susan Welts. I'm the Academic Chair for the Imaging Programs here at Michener. The programs I manage are the Nuclear Medicine and Molecular Imaging Technology Program, the Radiological Technology Program, and also the Ultrasound Program. In addition to being the Academic Chair here at Michener, I was also a student here at Michener and a proud alumnus now. And I was also a faculty member here. So I have a lot of experience within the Michener family, and I'm really proud of the type of graduates we create by the intensive type of learning that the students do, both didactically in our laboratory and simulation environments, and the strong clinical relationships that we have with our clinical partners that extend over to our students and their experiences. It is really an incredible educational experience, and I can speak to that from my own experience and the experience, I hope, of the many students that have gone through the programs that I've either been able to teach in or be part of as an academic chair.
Hi, my name is Julia DeRuscio. I'm an assistant professor with the Radiological Technology faculty here at the Michener Institute. The Radiological Technology program is a 3-year program. The first 2 years are mostly spent on site here at the Michener Institute. The last year is a 9-month-long clinical placement. You'll also have a short 8-week clinical placement at the end of your first year. A lot of our learning is done in small class sizes, groups of about 8 students. There's a lot of one-on-one opportunities with the instructors. There's usually multiple instructors in each lab, with small groups of students as well. We have a lot of awesome equipment here that really helps us to learn and practice a lot of the physical and technical skills that we'll do as technologists on the day-to-day out in the hospitals. At the end of the program, you will earn a Bachelor of Science in Medical Radiation Sciences from the University of Toronto, as well as an advanced diploma in Radiological Technology from the Michener Institute. So I myself am a graduate of the Michener Institute and the Radiological Technology program, so I still currently do practice as an X-ray technologist as well as a CT technologist at some Toronto hospitals. A lot of our faculty were graduates of the Michener Institute themselves, and some of them also do still practice. So you're getting a lot of good experience and learning opportunities from people that are still in the field. What I really loved about the Michener as a student was the small class sizes and really getting to work closely with my instructors and my fellow students. It was really great to collaborate with peers and with the instructors as well. Really benefited my learning. We were able to be very hands-on with a lot of the equipment, and a lot of the equipment that we're using on site is very similar to the equipment that I still use clinically outside of my role here at the Michener. So the Radiological Technology program is a second entry program, which means that you can apply to the program after just 1 year of university, and that was my personal experience. So I had started when I was leaving high school, really interested in a healthcare professional field. Wasn't exactly sure what I wanted, so I kept my first year of university pretty general and stumbled upon the Michener Institute and was able to really investigate a lot of unique health professions that maybe weren't so accessible just via an undergrad degree. So the Michener Institute really set me up for interesting healthcare career. So I really loved the Radiological Technology program, getting to take images. It's a really dynamic profession as well. There's a lot of different places that we can work. We can work in clinics, we can work in hospitals, we can be a part of research, be a part of equipment design and maintenance. There's really a lot of endless possibilities with the Radiological Technology background. So many members of the public might believe that radiological technologists are just button pushers. We just take the picture and move on. In reality, we actually have a very heavy hand in patient care. There's a lot of special procedures that we're involved in. We may have to put IVs into our patients, especially in CT scan. There may be some instances where we're involved in more invasive procedures where we'll have to scrub in and monitor the patient. So a lot of our education here at the Michener is focused on patient care and patient care skills, ways to keep our patients safe and perform a lot of these procedures safely. Given the current pandemic situation, a lot of our courses have been transitioned online, but we're still able to hold a lot of our hands-on labs on site here at the Michener with proper safety measures like face shields and masks worn at all times. We're limiting the number of students that are in the lab space at a time and have floor markers for distancing as well. We have a lot of cleaning supplies handy, a lot of hand hygiene stations available to keep ourselves clean and safe throughout our lab time. The radiological technology profession is very dynamic. There's a lot of different and interesting places that your career can take you, including education, research, different patient care and hospital administration roles, different kind of technical and radiation safety roles as well. We hope that you consider radiological technology as a future career, and we'll look forward to seeing you on site here shortly. So we are in the CT scan room at the Michener. We have a CT scanner, and we're able to scan our phantoms again in real time. So I'm going to get the patient ready for the scan. So I'm going to adjust my patient into the position for the scan here. So I'll raise their bed up to an appropriate height here, so they're right in the middle of that circle. Okay. All right. So patient's in a good position here for the scan, so we'll go out to the control panel and start the scan here. The CT instructional starts in second year, so first year we'll focus mainly on X-ray and X-ray principles. You will get a little bit of exposure in CT in your first clinical placement, your first 8-week placement at the end of first year, but second year is a bit more CT heavy. This is when we'll start to use the CT scanner and learn about different CT protocols and ways that we use CT clinically. So CT scans are, of course, pretty useful in a lot of different diagnostic areas of the hospital to assess a lot of different conditions and a lot of different diseases. We also use CT as a therapeutic method to put in different drains and biopsies for patients with under investigation for different types of surgery, as well as providing therapies for different types of conditions. So the CT scanners that we have, or the scanner that we have on site at Michener, really helps students to prepare for clinical placement. The scanners are very similar to the CT scanners that are currently in use in a lot of Toronto hospitals, so it really helps to prepare students for clinical placement in the Toronto area.
Hi, my name is Taryn Lim, and I'm a professor here for the Radiological Technology program at Michener, and we are in our lab space here in room C. This is a pretty big room. We have an X-ray tube here, we have a digital detector, and a large table. So this room is really nice. We can fit stretchers in here, we can fit our C-arm OR equipment, so it's really nice to have this big space. Okay, so I'm going to take a hand X-ray of my patient over there. She's already sitting down, so for safety precautions, I've put on my surgical mask and I'm going to put on my face shield. Okay, I'm going to start by giving my patient this lead apron. Okay, just to protect her, and her legs are away from the detector there. Okay, so I'm just going to move my tube over. Okay, I'm going to turn my light on. There we go. Okay. Okay, Julia, can you put your left arm on the detector there? Open your fingers nice and wide. Okay, just gonna and just move your hand down a bit. Good. Okay, sorry. Okay, now we're ready to take the X-ray. Are you comfortable? Yep. Okay, I'm just going to leave the room and take the exposure. So this is our CR machine that we use when we practice imaging in the OR. This is really important because when you go for your clinical placement, you'll need to know how to manipulate the equipment when you go to the OR for certain procedures. So here we have everything on our screen that we can manipulate. Depending on what procedure we're doing, we can choose our technical factors. We can rotate the image when it comes on the screen, and it's really user-friendly. So as you can see, Julia here is manipulating our equipment depending on what body part we're imaging in the OR. And we have our full body phantom here on the table. So this is a full body. We can image from their head down to their feet, and it mimics real bones. Okay, so here we have our patient list. So this is where we go in and we find our patient based on the positioning that we need for the day. So here you can see Julia selected a thorax, So we have the image pop up here that we've taken earlier of the patient. We can play with the contrast, the density. We can turn the image around, and we can also pass it to the other screen. And that stays on the other screen even when we do fluoro, so the doctor can have a reference image. Okay, so here we have our mobile unit. This is what we use for patients that aren't able to come down to the imaging department. They're too sick or they're post-surgery, so we bring the x-ray machine to them. So I'm just manipulating it here. Drives really easily. Just gonna put up the braille. There we go. Okay. I'm just going to manipulate my tube here. We're taking a chest x-ray of our patient. Okay, there we go. Perfect. Okay. And in this case, I would just place the imaging plate or the x-ray plate behind our patient here. Perfect. Are you comfortable, Julia? Yep. Okay, great. I'm going to step away and take the x-ray now. I want you to take a big breath in and hold your breath. Okay, expose, all clear, and our x-ray is done. Perfect. Thanks, Julia. You can breathe again.